My name is Steve Babb, and I'm a public health analyst at the CDC Office on Smoking and Health, and I work primarily on cessation issues. And I'm joined today by my colleagues, Brenna VanFrank and Robin Scala. And we're going to give a very brief presentation just to set up some of the discussion. And the focus of the presentation is kind of approaches and considerations around supportive messaging to help residents in public housing quit smoking. And some of the considerations we're going to talk about are applicable pretty much to working with anybody who smokes or uses tobacco products, and some are a little bit more specific to this particular population. So Robin, you can go ahead and move to the second slide, if you would. So one just important sort of background fact always to keep in mind when working with people to help them quit smoking is tobacco use is a chronic relapsing disease. It's really, in some ways, it's helpful to think of it as a chronic disease, just like hypertension, for example. And the reason that that tobacco use in particular is a chronic disease is largely because nicotine is a very, very powerfully addictive drug. And this means that most people, so we know that most smokers want to quit, but in most cases, they need to try to quit multiple times before succeeding. The quit rate on any given quit attempt is relatively low for various reasons. One reason is that, as we'll see shortly, most smokers don't typically use evidence-based cessation approaches when they're trying to quit, but also it's just very hard to quit even with evidence-based treatments. So as a result of that first fact that smokers make multiple quit attempts, as many as 30 or more before they succeed, that has implications for healthcare providers and other providers, social service providers, housing authorities, and others who are working with smokers to help them quit. And the main implication is it's not a one-shot deal. You're going to need to be there for smokers, providing support on an ongoing basis, helping them learn from what worked and what didn't work in previous quit attempts until they figure out the approach that helps them quit for good. And I think one just a very basic principle is you don't want to give up on smokers. You never want to give up on people who smoke and their ability to quit, and you don't want to let them give up on themselves either. The good news here is there are a number of effective treatments that have been identified, including both behavioral treatments and medication, and those treatments can double or even, in some cases, triple the odds of success on any given quit attempt. Next slide, please. So this is just a snapshot of some top-line facts about quitting. This comes from 2015 information from the National Health Interview Survey. So, and this is actually among U.S. adults who are current smokers. So you can see really more than 2/3 of them say that they're interested in quitting. They want to quit, and we know from other surveys that most smokers say they regret ever starting. In most cases, they started in their teens, and they wish they had never started, and they want to quit. And that also expresses itself not only in what they say they want to do, but what they actually do, which is more than half of smokers make a serious quit attempt of at least one day or more within the past year. So that again indicates, that they really do want to try and quit, and they're trying to quit, but the challenge is it's hard to quit, as we talked about earlier, and that's illustrated by the last stat here, which is in any given year, only about 7% of smokers succeed in quitting. Next slide, please. So this slide provides a little bit more specific information about how adult smokers tried to quit, the approaches they used to try to quit in 2015. So among adults who smoked and saw a healthcare professional in the past year, about 3 out of 5 received advice to quit. I guess you could see that as either the glass is half empty or the glass is half full. It's good that, you know, majority of providers are advising their patients who smoke to quit. On the other hand, providing that type of advice is one of the very briefest interventions that a provider can give. You know, you can do it in as little as 2 or 3 minutes. And while even very brief advice increases quit rates among patients, you know, more intensive interventions such as providing actual assistance, prescribing cessation medications, and providing follow-up and connecting patients to quit lines and other cessation resources increases quit rates even more. So the fact that, you know, 2 out of 5 providers are not providing even kind of the most basic and minimal type of cessation intervention is a bit of a concern. So importantly, 2 out of 3 smokers who tried to quit in 2015 did not use any evidence-based cessation treatment. They didn't use any cessation medications, not even like the nicotine patch or gum, or get any counseling or behavioral support. Of those who did use some form of proven cessation treatment, far more used cessation medications than counseling. Maybe not totally surprising, because I think some people are resistant to getting counseling, and it's a bigger time commitment to get counseling. However, we know that, you know, the combination that gives you the optimal chance of quitting is to use counseling and medication together. And one reason for that is the person giving you the counseling, whether you're getting that counseling in person or over the phone, or, you know, in a group format or some other way, can also instruct you in how to use the medications properly and what to expect, how to deal with side effects, you know, help you maybe select the medication or combination of medication that works best for you. So counseling and medication together is kind of the gold standard, and that makes the last stat on this page concerning, because again, of all smokers who tried to quit in 2015, fewer than 1 in 20 used that combination. And so, you know, they're really not giving themselves the best chance to quit. And as you can see, of the counseling sources that were used, the most common is quit lines. Maybe not surprising, because it's probably the most convenient form of counseling. And folks who use medications were more likely to use over-the-counter medications like basically nicotine replacement therapy, like the patch gum or lozenge, than prescription medication like bupropion and varenicline, or like the nicotine inhaler or nasal spray. Again, you know, probably not surprising, because over-the-counter meds are obviously a little bit easier to access. So please, if you could go ahead and go to the next slide. And Brenna, I think this is where I hand it off to you, if I remember right.
Yep, that's right. Can you guys hear me?
Yes.
Brilliant. So I'm Brenna VanFrank. I am the Senior Medical Officer in the Office on Smoking and Health. I'm a pediatrician and a preventive medicine doc. And so I'm going to just talk a little bit about really sort of how to talk to patients. And I'm going to hand it off to Robin. So I think Steve has covered most of this. You know, the big take home here is that we know what works. There are treatments that we have available, but people are just not using them. And so figuring out a way to help folks access these treatments and help them actually utilize these treatments comes down to not only decreasing barriers, but also engaging them in ways that, that they need to be engaged. Next slide, please. So it's fairly straightforward. I'll be honest. I mean, it fundamentally, human beings, patients or otherwise, want to be supported. They want to be respected, and they're looking for some guidance when they're seeking medical care. So messages, all of this information comes from some qualitative studies, from some quantitative studies, just asking folks, how do you best what do you want your providers to say to you? How do you best respond to messaging? And talking to patients is just talking to patients, right? Being straightforward, being very non-judgmental, having a really clear, strong, and personalized message. I like to call this the 15-second elevator speech, really knowing what you're going to say and how you're going to say it, to be supportive and offer help, but also craft it in a way that that they can resonate with. Bringing your empathy and your support to bear, because again, reframing this as a chronic disease. This is about long-term support and treatment of addiction, quite frankly. A lot of folks in qualitative studies push back against the finger wagging, the negative framing, and I'll give you a couple of examples on the next slide. But some patients report, I just don't want to talk about it because I know I'm just going to be told that it's going to kill me, and that's not helpful to me. I know that, and that's not supportive. So leaving the lecture at the door and bringing your offer of help to bear, and really listening to patients about what it is that they need from us. Next slide, please. So I'm going to walk you through just a few examples. We talk a lot about asking folks whether or not they're using tobacco, and then giving them some advice about not using tobacco as the premise for launching into our offering of treatment. And really, what you say sets the tone, and how you say it sets the tone for the entire visit. And you all know this anyway, but the first question out of your mouth is going to be the one that sets the tone. So click, Robin. So this is not the way to start that conversation. You don't smoke, do you? Has a lot of negative connotation. It has a lot of presumption. It has a lot of judgment. A better way to approach this might be click. Have you ever smoked cigarettes or used other tobacco products? This is product agnostic. This is less judgmental, opens the door a bit more to conversation. What you don't want to say would be click. Are you a smoker, or worse yet, someone that you've been working with on cessation? Are you still a smoker? You might approach this differently. Click. To really open the door to that conversation. So saying, gosh, we've been working on quitting. Those first few weeks can be really hard. Have you felt the urge to smoke? Normalizing that potential recurrence of the disorder. Then talking about advice, ways to maybe not approach this, click, are what we've already talked about, that negative framing and the messages, the lecture-y kinds of messages. That stuff's going to kill you, or gosh, if you quit smoking, your cough would get better. Different ways to approach this might be click. Quitting tobacco is one of the most important things you can do for your health. And you have probably heard this message in these exact words over and over, because it is all over materials, all over the place. And really should be part of your personalized 30-second elevator speech. Click. Another way to open the door is to really normalize. It's hard. I know that it's hard. I understand that it's hard. I'm not here to judge you, but I'm here to support you, and I can help you. Really offering that empathetic normalization. I'm not here to give you lecture. I'm here to offer you support. Click. And then opening the door to what they want rather than coming to the conversation with, these are the things that I want you to do. Coming to the conversation, what are your thoughts about this? What have you tried before? What have you not tried before? What's worked for you in the past? So really bringing that empathy, bringing that open conversation to bear. Click. Robin, your turn.
Great. Thank you. Hi, I'm Robin Scala. I'm a health communications specialist in CDC's Office on Smoking and Health. Steve and Brenna have focused talking to individual smokers about cessation, and now I'm going to talk about population-based interventions to support cessation. And first are mass reach media campaigns. And mass media campaigns can support cessation, and hard-hitting ads with graphic images and testimonials are most effective, plus you want to tag them with a quit line number or a cessation website, a call to action. And they're effective in increasing quit line calls, increasing cessation, decreasing tobacco use, and they're also effective in encouraging conversations between people who smoke and their loved ones. And promoting cessation services also has a broader population effect. It not only increases quit attempts and cessation in smokers that don't even use services, it also normalizes quitting and assures smokers that help is available. So you can see here an example of an ad on the slide that has the components that I just talked about on the last slide. Hard-hitting ad with a call to action. And so those are important for messaging considerations. You want to use proven cessation treatments to increase the chances of success that Steve talked about earlier. You don't want to discourage smokers from trying to quit without treatment, because some folks will do that, and you definitely want to encourage smokers to keep trying to quit because it won't necessarily work on the first try. So another population-based approach to support cessation is development and implementation of smoke-free policies, and smoke-free policies can support cessation. The primary purpose, of course, is to protect non-smokers from secondhand smoke, but these policies also change social norms, motivate smokers to quit and make quitting easier, increase cessation and reduce tobacco use, and create an opportunity to also promote cessation. And approximately 1 in 4 non-smokers are exposed to secondhand smoke, and that's really important. And studies found that a majority of multi-unit housing residents want smoke-free building policies. So this is something important to keep in mind. So we know that messages about secondhand smoke and smoke-free policies support cessation, and supporting cessation can build support for a smoke-free policy and ease implementation. Smokers who intend to quit smoking in 6 months or less are more likely to support smoke-free policies, but the messaging needs to be delivered carefully, and the flyer on this slide models that approach that I talked about. The policy doesn't require you to quit. It offers a great opportunity, and if you want help quitting, we're here for you. And I have another visual of that slide that I'll talk about in a moment. A study of subsidized multi-unit housing residents found that more knowledge of specific secondhand smoke health effects and feeling that it is wrong to smoke when children are gone but will be around later were consistent predictors of supporting smoke-free policies. And Bill Cook of the King County Public Housing Authority from Washington State observed and shared on one of our webinars that at one of the first meetings they had, there was a debate between residents and managers about whether the policy made sense. And one resident shared that it's not fair to her 4-year-old granddaughter to be exposed to this when she visits her grandmother. And no one was able to argue against that. And they started using that argument in other meetings with great effect. So keep that in mind. And you can see there's a link on the slide that you'll receive. If you want more information about specific health effects of secondhand smoke, you can see the CDC OSH website section on secondhand smoke, which has terrific fact sheets and infographics. And getting the word out to reach your audience. Posters, flyers, and brochures are especially effective in areas where folks are thinking about the issue in the building, but also think about where else they go, like health clinics or other offices they visit to receive services within the community. You can also consider getting the word out at community or national events, such as the American Cancer Society's Great American Smokeout, and other health and heritage observances can also be leveraged to promote messages. And now I'm going to talk about where you can find resources to support this type of work, free and low-cost materials, and ads, some of which I think you're already familiar with. And first is the CDC Tips from Former Smokers campaign, which has been on air nationally since 2012. And the Tips campaign profiles real people who are living with the serious long-term health effects from smoking and secondhand smoke exposure. And the Tips campaign gives you access to free and low-cost ads and materials that have been proven effective in support of cessation and smoke-free air, and we encourage you to use those ads. We also developed Tips posters focusing on supportive cessation and secondhand smoke messages in English and Spanish. And these are a great complement to the hard-hitting ads that we have running nationally, often 25 plus weeks a year. And these posters are available for free to download from the Tips Download Center. If you would like them as is, the link is there on the slide. If you want to customize them, there is our Media Campaign Resource Center, which I'll talk about in a moment. But these Tips posters are great for placing at community centers, health centers, WIC clinics, and other settings to start a conversation about secondhand smoke or quitting smoking and let people know about free cessation resources. They're a great icebreaker and a great opportunity to provide cessation support in these locations or refer them to the Quit line. We also created a cessation resource flyer available in English and Spanish that encourages residents living in smoke-free multi-unit housing to use the smoke-free policy as an opportunity to quit smoking. In addition to posting in common areas, this flyer can be shared as a handout at meetings, inserted in newsletters, or included in other communications you may have with residents and staff in smoke-free buildings. It's designed to print on 8.5 by 11 regular size paper in either color or black and white, and there are two versions. So you can see on the slide, one for when a smoke-free policy is pending and another when the smoke-free policy goes into effect, and you can find that on our Tips partner pages at the link on the slide under the Organizations for Serving Public Housing Residents page or on our Tips Campaign Download Center. The Media Campaign Resource Center that I mentioned a bit ago gives you access to existing tobacco education advertising. Over half of the collection is free. Many of the other ads are low cost, and you can use the MCRC for creative to use in paid media campaigns. If you don't have funding, that does not mean you can't do any media activity. The MCRC can help you with that too. For example, we have a lot of social media images that can be integrated into your program social media calendar, and our posters or videos can be used in community or outreach efforts such as in clinics, schools, churches, or elsewhere, and digital ads can be placed on your own website. This slide just shows you where you go for what. All the way to the right is the Tips website where you can pretty much access everything about the campaign. All the way to the left is the Media Campaign Resource Center where you can go for to tag ads with your logo or alter the ad call to action slightly. And if you're doing a paid campaign, and in the middle is our campaign download center at plowsharegroup.com/CDC tips, where you can use as is ads. If you're using them for free placement, you could just download them from the site. So if my voice has put you to sleep, now you can wake up, and I will just briefly share our takeaways, which are first, individuals want support, respect, and guidance. 2, effective treatments for tobacco use and dependence are available but are underused. 3, free help is available to increase the chances of quit success. 4, mass media campaigns and smoke-free policies motivate people to try to quit. And 5, promotion strategies can increase use of cessation services and quitting. And 6, CDC OSH has free and low-cost evidence-based media materials that you can use, and we encourage you to do so. And then here is my contact information. If you'd like to get in touch with any of us, we are happy to help you. Thank you.
Robin and Brenna and Steve, that was fantastic information. Thank you so much. We have time for a couple of questions before we move into our sort of different case presentation format. Does anybody have any questions about anything just presented?
Yeah, this is Frank. I always wanted to ask one of you in your position this question, because I've been doing this a long time, and it occurs to me that if we could get the right person, and I honestly don't know who that is, but some big star, some singer, one of the Kardashians, somebody like that, to a campaign where they said, smoking is ugly. I would never kiss a boy who smokes, or if there was a man, I would never kiss a girl who smokes. But somebody of a high enough profile to do that. Do you think that would have any effect? And Is that possible, or is it kind of just a pie in the sky idea?
Hi, Frank. I'll take that question. It's Robin Scala. So I'll let you know that working with celebrities is very risky. And, you know, if a celebrity is telling their own story about their own struggle and a personal message, that could be, something if it's a personal message related to smoking. But I'll tell you, the behavior of some celebrities can be questionable at times, not to judge, but you really want to be careful about who's giving your message and what type of message they're giving. And we have information about that I'd be happy to share with you to provide some additional insight. This year for the 2019 TIPS campaign, we have the wife of Leonard Nimoy, who is sharing the story about Leonard Nimoy's COPD and his struggle related to his smoking-related illness. I know some folks have had great success working with celebrities. I know FDA, Center for Tobacco Products has, and Truth Initiative has, but sometimes it can be a slippery slope. So it's something you could do, but you want to do with caution, really.
Yeah, I understand that. I agree. Was Leonard Nimoy himself approached about it, and would you think that would have been more powerful coming directly from him rather than his wife?
So I'm not sure. I don't know, Brenna, if you have any more information about that, but I really honestly cannot say. We just had the opportunity to work with his family. It was based on his wishes. But we didn't work with his family until he had passed from his smoking-related disease.
Thanks. Just curious.
Sure.
Right, thanks for those questions. All right, anything else before we move on?
I have one question. This is Laura McGrath at ACS. Thanks so much, Steve, Robin, and Brenna, for joining us today. I know you have your really great and helpful section on your website for resources for public housing, which we've used with our group here. But I was curious if you have any information or experience with the TIPS campaign specifically in any of the, I don't know what you call them, the series that work better or work best for the settings where our partners are taking care of patients and residents. Any experience with that?
So you mean like within community health centers?
Yeah, so like for public housing, the housing facilities themselves, or the health centers, do you have any experience or data, anything about like which series of the TIPS campaigns work the best? Just to sort of direct people in the right place. If you even have that yet, you may not. I was just curious if you had any thoughts on that. Yeah.
So I don't know if this answers your question entirely, but I'll tell you that, for example, the National Association of County and City Health Officials and some of their local health departments, as well as the National Center for Health and Public Housing that worked with some of their local health departments, shared TIPS materials and resources in health centers. And the healthcare provider saw very significant increases in smoking cessation interventions by using those ads in these locations. And so I'm sure those folks would be happy to share some of that with you, but I'll also tell you that they do have final reports from their efforts over the last couple of years that have a number of insights into the success that they achieved, and have some photographs of some of the posters they used. And then you can also see some of the posters that were in this slide deck that were used in some of the community health center settings that I talked about. So some of that might be helpful to you. Do you have other more specific questions? Because they do have some stats and data in there and examples of the posters.
Oh, that's great. That's great, Robin. Thanks. That's super helpful. I don't know, Bob is with us. Bob Burns from the National Center for Health and Public Housing. I don't know if you had anything you would like to add on that, Bob, or any ideas on that? Come off mute first. I think you're muted. Yeah, there.
Sorry, I was having a little trouble unmuting.
Okay.
Yeah, I mean, the process worked great. I think the health centers and folks who were involved were very happy with the assistance that CDC and Plowshare provided to them and guidance on how to use the materials. And just going through the process was really beneficial because it brought a lot of enthusiasm even amongst the staff. So, and if you remember the numbers, Robin, I mean, most of them, it was about a 10-fold increase in the number of people who were getting into some kind of counseling or treatment and attempting smoking cessation. And in addition, they got a lot more interest from the providers in participating in counseling groups and in just getting kind of focused again on tobacco cessation as a priority. So it was really a tremendous, win-win across the board.
Thanks, Bob. I'll also add to that. You reminded me that on the download center, and there's a slide that we have for that in this deck, there's a tab that's a HUD tab. And if you click on the print and the HUD tab, you can see some of the posters that we used and recommended. And some of these, there are hard-hitting posters, but then there are also, which I showed on the slide with the 3 posters on it, some of the more supportive and encouraging messaging that folks used, and also the information about secondhand smoke that we learned people really need more information about the dangers of exposure to secondhand smoke. And so those tips ads, some of them that are more supportive or under that print HUD tab, are really great options that we encourage people to use for that particular type of effort that you're asking about.
Oh, that's great. That's perfect. Exactly what I was hoping.
They see the hard hitting ads on TV.
Yeah, that's great.